Good morning, I'm Jessica Lovell. Today we bring you an encore presentation of one of our very favorite programs. We'll still be live with you this summer, Monday, Wednesdays, and Fridays, and then come September, we'll be back with our regularly scheduled programming. Until then, enjoy this encore presentation and make it a great day. Coming up today on the Morning Medical Update, a dive into a swimming pool took an unexpected turn, but how a second opinion helped save this man's arm. And it's pop quiz time. The FDA expanded authorizations for the bivalent COVID-19 vaccine booster shot to include which of these age groups? Dr. Hawkinson reveals the answer coming up next. I'm Jessica Lovell. Welcome to the Morning Medical Update. We are live inside the Dolph C. Simons Jr. Family Broadcast Studio. So glad you are with us. Get your questions sent in to us on YouTube, Facebook, and the Medical News Network. You can find links to those right here on your screen, and you can also put them in the chat thread below. We'll get to those in just a bit. All week, we are dedicating our time to the power of a second opinion, why they matter, and the remarkable outcomes after receiving one. And today we have one of those stories. Dennis Evans joins us virtually to tell us about that fateful dive. And we have his orthopedic surgeon and the man that Dennis credits for giving him his life back. Dr. Tyler Fox joins us here in studio. Welcome to both of you. How are you? Dennis, good morning.
Good morning. Thank you.
It's been a long time that the two of you have seen each other, Dr. Fox, right? And that's correct. And that's a good thing. You say that's a good thing when you don't have to see your patients, right? But you two are having a little bit of a reunion, right?
We are. We were just catching up.
And you were having him stretch his arm out and see what he was doing?
Yes, it sounds like he's doing very well.
So, Dennis, you were hanging out at the pool. Take us back to this day, this beautiful summer day, hanging out at the pool with your family. You guys were diving in and having a good time, and you took one last dive. What happened?
One last dive. I was already out of the pool, drying off, and my daughter coerced me into one more dive. We were diving. She was young, and we were diving for scores. The wife was out sunning and was giving us scores for dives. And at that point in time, I think I had a edge on her, and she was wanting to try one more dive to see if she could get me. And so I said, sure, you're right. So I got up on the diving board and did one more dive. And when I entered the water, I'd done that dive 10, 15 times that day already, and hundreds of times over the span of my, time at that pool. It's my hometown pool, born and raised there, and I hit the water, and I knew something was different. And when I was starting to come up, I realized something was different in my arm. I couldn't really tell what it was at the point in time, but knew something was different. And came up, I was getting a great score from the judges, but I was struggling a little bit there. I was trying to figure out what was going on here in my right arm, and the lifeguard was like, "You all right?" And I went, "Yeah, I'm doing all right. I just got to figure out what's going on." And then the wife could see me getting to the side of the pool and could see something was different, from the back, my shoulder looked displaced, and that kind of started the whole process.
Wow. So that perfect 10 cost you a little bit there. So you thought, well, maybe you dislocated it or something, or pulled a muscle. That seems kind of maybe what you would go to, right?
Right. I thought I was dislocated, and I just get it back in. And I've had dislocations of the shoulder before, and I thought, I'll get it back in, but there was no chance that thing was getting back in.
Okay. So tell us what doctors were telling you at first. You went looking for answers, obviously, and what were they telling you?
Sure. Well, even the emergency room that night, went straight to the emergency room, worked on that after a couple hours there, and they sent me then to an orthopedic specialist the following morning, and that didn't go as well as I had hoped. It was let's let that heal for a little bit. Let's see in 6 weeks. And at first I thought, okay, that sounds pretty normal, I guess. And after about a week of that, I was not able to sleep. I was unable to do any really functionality because my arm was still dislocated. I had loss of function and feeling in my entire arm and hand, and I thought I need another option maybe. So I went to another doctor and got a similar response. I didn't think that was very good. And then I went to a third doctor and a specialist here in town, a team doctor that was supposed to be the local guru, and received the same information. And I voiced my displeasure there. I didn't think that how can waiting 6 to 8 weeks to let scar tissue form in the joint be a solution? It sounds like a pretty poor solution. And so he started giving me my alternatives. My arm might be something to always be one of those gentlemen you see with the arm in their pocket at all times, or a sling. It may not ever function properly, or at one point, he got frustrated with me and said, amputation is always an option if you don't want a lack of a functioning limb. And
Dennis.
that really, yes.
Yeah, that would be
right.
That would be reason for a second opinion. First, you're told you're going to have to stuff your arm down in your pants as an option. Then you're told that there's possibility of taking your arm off. I can understand why you would go in search of not just a second opinion, but maybe a third, a fourth, and even a fifth opinion in this case, right?
Absolutely. And if I can, because one individual actually opened the door for me and to Dr. Fox was at work. I had voiced my displeasure with some of my peers, and Jay Little, his wife Paula Little, works there at KU, and he was like, "Can Paula call you?" And I was like, "Sure." And so his wife called me, and she referenced me, says, "We have a specialist gentleman here at the hospital. I think can work some magic with your shoulder. Would you be interested in meeting with him?" I said, "Absolutely." I mean, I'm at the point, I was so frustrated. At this point, I'm already 3 weeks or 4 weeks into my shoulder, and again, can't sleep. It's got some aggravating pain in it, and I was at that point, absolutely. I'll do anything at this point to try to get a better solution than what I've been hearing, and then the rest is history with my path I've had with Dr. Fox.
Well, let's bring Dr. Fox in right now. So, what do you remember when you first met Dennis?
I remember the anxiety about what he'd been told, understandably so. And I remember the complexities of the injury. And I think what was creating some of the confusion was that he had had a significant nerve injury in addition to the tendon tears at the shoulder that were more obvious.
How does that happen from a dive into a swimming pool?
Yeah, if you hit the water just right, you can dislocate the shoulder, and I think you're exactly right, Mr. Evans, that you had dislocated your shoulder, and in doing so had torn many of the important tendons that help you to move your arm. And with the shoulder being out of place, you were able to stretch some of the important nerves at your arm, and I think that may have created some of the confusion and some of the opinions that you were getting.
So, but you were able to give him a pretty good option pretty quick, Dennis. Is that, I understand, a surgery option that was going to work really well, correct?
Yeah, in these situations, there's no substitute for experience. And, as you specialize has become increasingly common in orthopedics, even things that seem relatively rare become a high volume, patient that you see. So
what kind of injuries would you see that might be comparable to something that Dennis experienced, that people might need to be on the lookout for, where they may need a second opinion?
Yeah, I think, in general, you want to get a second opinion if you're not comfortable with the opinions that you've been getting. If you're considering a procedure that's going to take you out of work or be expensive, then getting a second opinion makes sense.
What questions might I ask a doctor? And we were talking about this. You said that if you don't feel comfortable talking to your doctor about seeking a second opinion, then that's probably why you need to seek the second opinion. That your doctor should really support that route, right?
Reputable surgeons, especially at academic medical centers, it's part of the business. It should not make your doctor uncomfortable at all. If it does, then that's probably a reason to seek another opinion.
Good red flag. So when do you know to seek that second opinion? I mean, in every case, in some cases, how do you know when to go with what you're being told or when maybe to ask more questions?
Sure. I think, you have to trust the surgeon, especially in these sorts of cases, and so that's probably the key thing. But in cases of an acute trauma, like a fracture, you often don't have the luxury of the time to seek another opinion. But in cases like Dennis's, then there is a window that you can seek a second opinion without creating any sort of long-term harm.
And in this case, it made all the difference. Dennis, you were told you would never throw another baseball again. When I came into the studio, you were kind of showing us your arm movement, and Dr. Fox was really impressed with what you were able to do, right? You were able to raise your arm up and move your fingers, something you weren't able to do initially, right?
Absolutely. And through my quest for getting better, some of the doctors were being, professionals and giving me a diagnosis of my future, and were saying you'll probably never throw a baseball again. At that time, I was active as a coach, coaching a competitive softball team. I coached along with my wife a competitive volleyball and basketball team, and extremely active family, as you see there. And we that really seemed like a really poor solution. As a high school and college athlete, wife and I both, we were extremely competitive and active in our lifestyles. And I thought, man, that is a really bad diagnosis. Moving forward, I'd really like to be able to do some of those activities again. And so we, I really wanted to be able to get those activities back. And being right-handed and having a right arm, for being in those activities and being the coach of those activities, it was really important I get that right arm, at least some functionality back in that. So having Dr. Fox give me that hope and that more positive outlook and a timeline that was much more aggressive for me was the path I was looking for.
I'm glad you didn't give up. You sent us a really unique video. I said, do you have any video of you throwing a baseball? And you said, I don't have one of me throwing, but I have one of the batter receiving one of my new throws. And this young lady is practicing your throwing, and you'll see here, I think she breaks her bat. So that must be a good sign, right?
Yeah, it got a little heat on it, but of course that young lady has a great swing, and up there throwing at the dugout with some other coaches, and got the result we needed, right? But still got some ump on it, got some spin on that ball. So
I love it. I love
that's
it.
Important.
Well, again, and I would imagine just mentally and emotionally too, talk to us about that, because here you are being told, before you got to Dr. Fox, you're being told that not only is your arm not going to function just in day-to-day things, but you're not going to be able to do the things that you love, which is be active. What was that like for you emotionally, and maybe your advice to people about how to kind of keep that together and push forward?
Well, I think level of activity, what makes you happy. And coaching sports was one thing, but just being active. Some of those pictures I sent you wasn't me coaching; it was just me being with my family, and and having an arm and hugging, and just being active and close to normal would be a great start. Let alone the ability to be active in the sports aspects, right? Just being the ability to be a father and a husband, and have that arm for that that hug when you need to hand it out, and to be in that faction. So. Having that beam of light given to me by Dr. Fox, just being able to as close to normal as possible and be able to be the father and husband I need to be, and then having that gleam of light that I can still be active as a coach or at some level was just icing on the cake.
As I mentioned, you said Dr. Fox helped give you your life back. How does that make you feel, Dr. Fox, when you see someone? I know it's been several years since you all have met, but seen each other again, which is a good sign that he hasn't had to come back. But it must be really rewarding for you. It
is. I don't know that I deserve all that credit, Mr. Evans. With the rehab, has played a large part in his own outcome. Well, that's what my next question has been. What is the rehab for this, and the post-care that comes in? And you're right, what Dennis has to do to make all this possible. Yeah, and I think some of the confusion here was the difference between an acute and a chronic rotator cuff tear and the nerve injury that he had that complicated the situation. The rehab can be long. It can, and if someone's not motivated, that can certainly alter their outcome. Dennis, you did a lot of the work. Tell us about the rehab and how important that was, sticking with it.
Well, rehab is important. I've had several knee injuries and things over the years, and I understand that if you don't rehab aggressively and rehab properly, that you're only as good as your efforts put into that. So knowing that it's on me at that point, I own that, and I did everything that was asked of me, I hope, and I did it as prescribed. I did it as often as possible, probably more so because I'm one of those, if a little bit's good, then a lot's better. And to the point where my therapist was having me tap the brakes a few times because of my aggressiveness, but I also didn't want to tear it up. And so early on, but it's, I think it's the onus is on you, and sometimes there's a little pain involved in that, and you've got to be able to push through some of those sometimes. But it's all for the good, the long-term goal, and it takes time, and it's not fun, but it's the end goal.
Yeah.
I wanted to get out there and get back out there and get out of that sling and get back to normalcy.
You were determined. Yeah, 50% great surgeon, 50% great patient, doing what you're supposed to do. So that's good. You're a good advocate for yourself and setting a great example for folks going through the same thing. I want to check in with Dr. Dana Hawkinson. Earlier, we put our viewers to the test to see if they've been hanging on your every word.
Yeah, right.
I'm sure they have been,
Yeah.
right? Okay, so the FDA expanded authorizations for the bivalent COVID-19 vaccine booster shot to include which of these, A, B, or C? 6 months to 2 years, 3 to 4 years, 5 years and older. I was hanging on your every word. I know the answer, but I'm going to let you reveal it to the viewers.
Well, I think it is vitally important for those young children to be protected, and we know certainly mom taking vaccine can transfer some of her antibodies from that vaccine to baby before birth, so that is a good thing. We know that those young kids really need to be protected. That's important because even though the virus affects children at lower proportions and severity than adults in general, they can still get infected and have disease. So that really young group, that 6 to 2 age, we really would like that. Right now, unfortunately, there is nothing. We know studies are ongoing. The 3 to 4 years is kind of random, but I think what the answer is, Jessica, is children 5 years and older are now able to get the booster vaccine.
We'll take it.
Yeah,
that's good
absolutely.
news. All right, get your kiddos boosted there.
If it's been 2 months since they have completed their primary series.
Okay, good to know. Let's get to our community question. And Dennis, Jonathan wants to know, how long after your surgery did it take for you to hug your family and maybe ultimately get back to baseball? But what kind of give us a time frame on how long it took you to get back to you?
Well, after the surgery, I was in that brace for several months, and but I was able to get back to some functionality of normalcy within several months of that. I'm thinking it was 6 weeks. It's been a couple of years, since we had that, but I think I was in that brace full time 6 weeks after the surgery, and then I was able to get different levels of degrees out of that brace and doing things, but full-time activity was several months after that. I was able to get range of motion and do the things that I was able to do and get some strength back in it. But as far as a comfort and probably normalcy, or get to a level of normalcy, maybe not as active as throwing and things like that. But within a month or two, I was easily within 2 months. I was able to use my arm with regards to some normal house general skills.
All right, you weren't cracking bats right out of the gate, but
No,
you got there
no,
eventually.
Got there eventually.
Eric wants to know, Dr. Fox, why was your view of what was going on with Dennis's shoulder and arm so different than maybe what other people were saying?
Sure.
Why would it be such a mess from something where you were able to diagnose it immediately and have a good option to somebody maybe thinking they could take an arm or have a dead arm?
Yeah, I think, like I was saying before, that increasing subspecialty tendencies in orthopedic surgery lead to things that are relatively rare becoming common in my office. And I think in this case, rotator cuff tears in general are common, more degenerative than acute traumatic tears like Mr. Evans. And the combination with brachial plexus injury, a nerve injury to some of the structures around the neck, complicated probably his presentation and what the other doctors were seeing. They may not have the sort of experience to recognize that combination of injuries when it shows up. They may be seeing it once a year, whereas in my office that's an every week problem.
Today we're talking about the power of a second opinion, and Isaac has a good question. Do you think that patients have the duty to tell the original doctor what the second opinion was? And should they? How important is that to somebody goes out, seeks a second opinion, comes back to you? How should that conversation happen?
I think most surgeons should be open to having a discussion about what the other doctor has told them. I think what you can do as a patient is to gather your records. You know, it certainly smooths things out and makes the most of your time if you have all the imaging studies, if you have the notes from the other surgeon, and then you can have an open and honest discussion. If they aren't willing to do that, then something may be wrong.
You mentioned this a little bit earlier. Janet wants to know, how long is too long to go without that second opinion? Could Dennis have gone so long that it would have been irreversible damage?
Sure. We know that acute rotator cuff tears are best managed within 6 weeks. Rotator cuff tears, tendon injuries like this, you have a period of weeks to months. Fractures, acute lacerations of tendons and nerves need to be managed within a period of a week or two.
Dr. Hawkinson, you heard me yesterday. I promised that I would get to a few COVID questions that we missed. So I want to keep my promise, and one of them is to Rita. She says she's having cataract surgery this week on Thursday. How long after the surgery should she wait to get her flu shot?
I don't think there's any time you need to wait at all. I don't think any of those interventions are going to interact or counteract with each other. Certainly you can talk to your eye doctor for the definitive answer on that. But I would say get the flu vaccine anytime you want, even go later that evening.
All right, Linda wants to know, a friend I know got her booster and tested positive for COVID 2 days later. Did she really get the full benefit of the booster long term?
The full benefit of the booster long term, absolutely. You know, you're also going to have that benefit of the actual infection, which you're going to create that immune response to other pieces of the virus, not just the spike protein. But yes, you will still get a benefit of the booster for that long term.
Okay, Joellen has one for you. I have been contacted multiple times over the past 2 years from vSafe process for my COVID vaccine booster. Do you know how vSafe is helping?
You know, it is a big collection source for data, and what is it for? It is to continue to track adverse events or things or signals in the data that may show us or signal to us that there may be vaccine safety issues, and that is what it is for. It is that database to collect as much information about it. We know that there's been some trepidation by people not wanting the vaccine because of concerns with safety issues. Again, we really have not seen that on the large scale, but that is what that is for, is to continue to track those types of data and then analyze it, of course, and then let the public know if there are safety concerns.
Last one for you is from Yen Liang. Could the antibody we got from the previous infections of COVID-19, could it prevent us from getting infections of the new variants that we now have?
So the antibody responses you do have to this particular infection that you do get are really going to be specific for that. Now, throughout time, we do know and understand that when you have had those vaccine doses, and probably if you do get exposed to spike from the actual virus itself, your body has this, your immune system has this ability to continue to evolve and develop neutralizing antibodies to variants you have not even seen yet. But if you are infected with the virus, you are really going to develop a pretty high antibody response to that viral spike itself. But again, we know that with multiple doses of the vaccine, your body is continuing to evolve and create those rearrangements to identify or to make those antibodies to variants we haven't even seen. So you will probably have some sort of level of neutralizing antibodies to current variants or variants you haven't seen. We just don't know in what proportion and how high. Again, the important thing to remember is that we still have those very good T-cell responses that are also boosted and created with the vaccine or with natural infection as well.
Catherine wants to know, is it necessary to wait 90 days after infection to get bivalent booster?
You know, it's not necessary. I think we believe that it is important because just going back to my last answer, that continues, that time period when you've been infected or vaccinated and to getting the next vaccine dose, that time period is when you are continuing to have that evolution of those B cells and T cells to create and be able to identify those variants that maybe we haven't even seen yet. So it is not necessary at all, but it does allow your immune system to continue to evolve during that time. And then, of course, after that 90 days, when you do get the vaccine boost, you will continue to have high levels of antibodies circulating because you've just gotten vaccinated.
Okay, I always say it's the last one and then I sneak one in
Yeah.
on you, but I promise that was the
These are
last
good
one.
questions today.
They are good
Yeah.
questions. I wanted to make sure we got those in today. But the last question is for you, Dr. Fox, and it is from Juan. Are there indications of regenerative medicine in dislocated shoulder?
I don't think there's a lot of proven science to support things like PRP injections, stem cell injections for shoulder dislocations. There may be in the future, but I don't think the science is there yet.
All right, I want to get to final thoughts because I know you have to get to patients. So, Dr. Fox, just your final thoughts for our viewers. What would you like them to know?
Don't be afraid to get a second opinion. Come prepared. Bring your records.
Ask lots of questions. Okay, Dennis, you did that. Your final thoughts, any advice you have for our viewers, any parting words?
No, I just appreciate the efforts. And if you don't hear the diagnosis, I think you owe it to yourself and your family to reach out and continue to find the right solution for you. And it's what we did, and I'm thankful for it. So thank you.
Dennis, thank you for being a great voice for our Second Opinion Week. We really appreciate it. It's a great story, and we're glad you didn't like the answer you heard, so you went for another one, and here you are. Cracking bats. I love it. I love it. All right, Dr. Hawkinson, final thoughts from you today.
Yeah, I have second, third, fourth opinions. Nobody wants to listen to them.
They don't want to hear them. They don't.
But I would say very good questions today. Again, I like these, just very basic about the immune system and immune response to vaccine and infection. Remember, the most important thing and safest thing is continue to be up to date with your vaccines. We know that right now overall cases and hospitalizations are down. We still have a few more than we would like here in the hospital, but the vast majority of those are not up to date with vaccine or not vaccinated at all. So the best thing to do is continue to be up to date and help develop those immune responses.
Great advice as always, Dr. Hawkinson. Thank you, and thank you for joining us today.
Subscribe to our morning medical update and open mics with Dr. Stites podcast. Now, everywhere podcasts are available.